Hi, everyone. Welcome back. I'm Dr. Samantha, the maternity mentor, and we're here for another one of our live Q&A sessions that we have every Monday at 9 p.m. Eastern Standard Time. This is my chance to interact with you guys and your chance to interact with me. Remember, we're on Facebook and Instagram for additional content, so we will link those into the description. And for those of you guys who stay until the end, I'll give you a sneak peek at tomorrow's video. Remember, if you want to get notified of the videos, please like and subscribe and hit the notifications bell. And we do have some exciting content coming up for you guys. For those of you who were here last week, I can see some of you already in the chat. Thank you. I'm going to do your questions first for sure. And just so y'all know, it's like 20-mile-per-hour winds out here. So hopefully we don't have weather that stops us from being able to stay on with you guys tonight. So any of you guys who come on who have any questions, please feel free to put them into the chat. Hi, Movie Mode. Thank you so much for being patient. Why does pregnancy hide any sort of pain-related issues? I had pain in my feet, and while pregnant, it disappeared and then returned after the baby was born. So I think this is a really great question to start out with, and I thought it to be very interesting. What I can say is that there is probably no specific answer for me to give you about that, meaning about pain in general. Let me rephrase that. However, putting the feet on there actually gives me a little bit more information. One of the things that happens during pregnancy is we have a hormone called relaxin that starts to increase over time. And the point of relaxin is to relax the joints all over your body. This is what causes women's noses to get bigger. It's also what causes feet to get bigger, and it causes your pelvis to kind of open up. That's the point of it. Ultimately, it's trying to get your pelvis to kind of relax. So that's what gives women that waddle, that like gait that we see them do towards the end of pregnancy. And it's all to promote the ability to have a healthy birth. I suspect with your feet, when it relaxed your feet, it helped to ease the pain because probably you had some inflammation going on, and that relaxing kind of effect helped. Pregnancy is this amazing situation. I have women who have severe psychological issues, depression, anxiety, suicidal ideation, bipolar disease. And when they become pregnant, they are able to go through their pregnancy sometimes without any medications, and they have no mood issues the entire time. I've seen women who've had different types of diseases like HPV that seem to somehow miraculously go away during pregnancy, and then it doesn't come back. At the same time, I have women who end up getting very severe symptoms. I had a woman, she's now about 3 months postpartum. She actually was using a walker at the end of her pregnancy because a previous car accident from 20 years ago somehow got aggravated by the pregnancy. And the second the baby came, it was gone again. So the pregnant body does all sorts of weird, amazing things. Everybody say hello to Figs. She always likes to make an appearance. So it has some really, really funny effects. But I suspect with like musculoskeletal pain, what you're talking about is that effect of relaxin, which does go away after you give birth. So that's what I imagine about that. And then Movie Mode, you actually had another question. You had that one. And then you said, how long does the area where the placenta was take to heal? Is that why they ask a person to wait before having another one? So with that, what I'm going to say is it probably varies, but basically it is so the placenta is an organ. This is all blood vessels, and it attaches to uterine wall. This is all going to be blood vessels. And that creates this vascular bed that kind of transports the oxygen and the nutrients back and forth between you and the baby. So when this placenta detaches, this area on the uterine wall is basically like an open wound. Now, when the uterus starts to contract back down after you give birth, well, when that happens, it starts to close off these blood vessels, right? But you could still consider it like an open wound that's like clotted off. So maybe like a really, really bad pressure ulcer, or really, really bad, I don't know, like a scraped knee, like as if you had been dragged across gravel or something. Like it's pretty bad. It probably takes about 6 weeks to heal. That's kind of why we say 6 weeks for pelvic rest after you give birth. The reason why we recommend baby spacing or waiting to get pregnant again has a lot more to do with all the other stuff that happens during pregnancy. So when you are pregnant, for starters, your immune system, it gets depressed. And that means it stops working as well, which is why pregnant women are considered immunocompromised and they're at higher risk for infections. Because when you're pregnant, if your immune system is at full-fledged effectiveness, it recognizes the baby's DNA as a foreign body, and it could actually cause an inflammatory response attacking the baby if we didn't have that natural mechanism. Now, the next thing is our cardiovascular system changes. We get massive amounts more of blood because now we have to circulate blood for us and for the baby. And so that puts a lot of strain on your cardiovascular system. Your heart is working harder, your vessels are working harder, everything is working harder to support that circulation. And once you give birth, all of that has to go back to normal. So if you aren't giving your body a chance to heal, then you could end up having a lot of consequences. Now, there's also some of the like diseases that we see, right? So we see a lot of different diseases during pregnancy, like preeclampsia, like gestational diabetes. So when you develop these situations, you are actually at higher risk for actually getting these long term. So gestational diabetes can turn into permanent diabetes. Preeclampsia can turn into permanent high blood pressure. So if you give your body, again, a chance to heal from all of that, then you have a greater chance of not becoming permanently diabetic or permanently hypertensive, but you also reduce your risk of having it in your next pregnancy. If your body hasn't had a chance to heal from that, then you're going to run the risk that that could come back. And then there's also organ displacement. I mean, the reality is these babies, when they're at the end, they're taking up all the space in your belly and they're pushing things out of the way. So your whole like abdomen, it just needs to kind of settle and get back to normal. Then the final thing I'm going to say is it really takes a year for you to figure out how to take care of a baby and keep a baby alive and keep yourself alive and just adjust to all of that. You grew a human being. It really takes your body a while to heal. And that's why we really recommend it. You also should understand anybody who looks at some of these guidelines. I truly believe that baby spacing with 2 years between babies is very, very healthy and what most people should do. But these are also guidelines created by the WHO, the World Health Organization. So they're responsible for guiding the health of people across the world. Not all of us are fortunate enough to be in a first world country like the United States or England, or, Germany or whatever. There are people all over the world that are living in situations where healthcare is hard to access, where they may not have the funds to go to a doctor, where they may not have access to clean water. There's all these different situations. And so when the World Health Organization is giving guidance, they're giving guidance to everybody and not just a singular group, because it would be really unfortunate if they were just talking to first world countries instead of all of us, because third world countries have it a lot harder for all of their pregnancies and stuff. So that's the other thing with that. Sales promoter. Okay. Hi. So my friend lost her baby due to an incompetent cervix. She is now pregnant again. How does she handle the constant visits to the bathroom and climbing out of bed? If she gets a cerclage or a pessary, does she have to be careful when getting out of bed? And lastly, how can one survive a bed rest if there's an incompetent cervix? So these are all great questions. I have a couple videos on like bed rests and stuff like that, but I think this is a really good it's a good subject matter. So for starters, what is an incompetent cervix? So you have a uterus, you have your cervix. Your cervix is supposed to be long, thick, and closed. This is exactly kind of what a cervix looks like. And actually, this is what it feels like. If you guys ever wanted to know what fingertip feels like when we're doing a vaginal exam, that's what it feels like. Put your finger right there. That's what fingertip feels like. So this cervix, it becomes incompetent when a couple different things happen. Either it dilates or it shortens. And so what happens with a shortening cervix is that as you contract, it kind of does this. And you can see my cervix is getting short right here, right? So when we have that, we worry that the baby could be born early. What a lot of people hear over and over is you have to get to 10 centimeters. But unfortunately, if you are 20 weeks pregnant, 18 weeks pregnant, and you dilate to 4 to 6 centimeters, you can actually deliver the baby because this is not a full size baby. So what we might do is we might do bed rest or cerclage. So a cerclage is simply stitching this closed. It literally looks like a sewing needle and sewing thread. Obviously, it's sterile. And we go in and we just stitch it closed. That's it. It's just trying to hold that together. If a mom starts to contract even with a cerclage in place and we can't stop the contractions, we actually have to snip that and let labor take its course, because if we don't, we could permanently damage the cervix and prevent a mom from ever being able to have a baby again, right? So there's that. Now, as far as getting in and out of bed. So the first thing is bed rest, and I say this in the video, it looks different for everybody. So some people's bed rest is basically you need to stay on the couch most of the time. You shouldn't work, but you can do light household chores. You can cook, you can go to the store. That actually is a form of bed rest. And then there are other people at the other extreme who cannot get out of bed at all. And in the hospital, we actually lay them with their head down. Okay. So this is their feet. This is their head. Just so you guys know, if you're at home doing bed rest, do not do that. You can actually cause a lot of problems. You have in a hospital where there are professionals monitoring you and your baby. But that's another form of bed rest at the other extreme. And then there's everything in between. So as far as getting in and out of the bed, that's actually dependent on your provider. So some people are allowed to get up and pee as much as they want, but they're not allowed to have a bowel movement in the bathroom. They have to do that in their bed in a oh my gosh, in a bedpan. Sorry, I had to think about it. Some people, it's the opposite. They can pee in a bedpan all the time, but they can go to the bathroom to poop. Some people are allowed to shower. Some people are not allowed to shower. So it kind of depends on what the provider is telling this person. One thing a lot of providers will allow people to do, this is the most common that I see, is they'll actually have you get a bedside commode. So it's kind of like, it looks kind of like a walker, but it's actually like a portable potty. And it sits right next to the bed, so you can get up and use that to go to the bathroom. So yes, you're getting in and out of bed, but you're not walking. Walking is actually part of the issue because remember, gravity pulls our babies down. And so the more you're upright, the more you're putting pressure on the cervix. So using a commode is sometimes a really good thing. So that may be what they decide to do. Everybody is different in their thing. Now, as far as a cerclage or a pessary, if you have it, you're going to get out of bed the same way you would get out of bed based on your bed rest. There's no difference. It's either going to hold or it's not. There's just no guarantee with cerclages or pessaries, and there's nothing specific you can do to try to keep it in place or keep it successful. Now, as far as surviving bed rest, I think that is an extremely valid question, because the thing is with bed rest, it is very isolating and it is very boring. I've taken care of women in the hospital for over 2 months who were on bed rest because their water broke and we were trying to keep them pregnant or something like that. 2 months where they were allowed to take a shower like every 3 days, where they were allowed to go to the bathroom for bowel movements, and where they were not allowed to get out of bed except to use a bowel movement or a shower, so we had to do like peeing in the bed, like in a bedpan. We showers 5 minutes. We literally had to set a timer because they couldn't be out longer than that. 2 months. It is hard. And so one of the things you can do for people with bed rest is organize it so that they have visitors every day, that people are coming in. You tell friends and family to not call them every day with new stories. Save those stories for when they come to visit somebody in person. We take that for granted because we're so used to calling people every day. But when you're on bed rest, you look forward to anything that's new. Try to surround yourself with new scents. So every day, maybe you're using a different air freshener, a different candle, lots of comfy pillows, comfy blankets, get lots of books to read, computer games, like anything you can think of. Nintendo Switches are like amazing if you guys like video games. So it's like you try to do all those novel things to keep your body and your brain going. Have your family make sure they're surprising you with yummy snacks and stuff that you keep at the bedside. And then one of the things we try to do is we try to get people to plan for their babies. You're doing bed rest for a reason. And so we want you to engage with that reason. So planning your baby shower, because it's going to be a bed rest baby shower, prepping the nursery, writing letters to the baby, all these other things to keep you connected to the reason why you're there. So those are some of the ways that you try to survive it. The other thing is checking in with your provider about the status of your bed rest. You might start out as that woman, and I've seen this, who is in the hospital being continuously monitored with your head down here and your feet up there, who cannot get out of the bed for anything. And 4 weeks later, you might be able to get up and walk around. You just can't work. It changes, believe it or not. It really does change. A lot of variables go into place to know what's going to happen. So I hope that helped with your question. Anybody who's here, please feel free to put your questions into the chat. I'm going to start answering some of the questions that I got on the videos this week and last week, because remember, I had to, I got off technology last week. So I had a question. Can a pregnant woman at 7 weeks, 4 days take magnesium? Should it be avoided since it might lower the baby's heart rate? So this is a great way to start out. Magnesium is very commonly used nowadays, and so it's really important to understand it. So magnesium sulfate is used for preeclampsia. We use it in the hospital. We give it to you IV. It is to help prevent seizures in mom if she has preeclampsia, and it is also to help with the baby to protect the brain. So we use magnesium very commonly, but if you heard me, I said magnesium sulfate, and that's the trick. Magnesium is a very misunderstood vitamin, and we definitely are learning more and more about it. It helps to produce serotonin. It helps with your bones. It helps with your mood. It helps with so many different things. But magnesium comes in a lot of different forms. Every form is different. I think there's 6 forms that I can think of. There's mag citrate, mag oxate, mag glycinate, mag sulfate. There's more. So you got my drift, right? So you need to know what magnesium you're taking, and then you know what milligram strength that you need. So you need to talk to your healthcare provider about this. The other thing a lot of people don't realize is magnesium is part of your electrolytes, right? So electrolytes all are intermingled. So when you affect one, you affect something else. For example, potassium and sodium, they're inverse. So they go up and down like this. So there's a lot of different interactions like that. So you can't just supplement one thing without knowing what the response would be. So generally speaking, for pregnancy, mag citrate and mag glycinate are safe. But you want to make sure that you're talking to your healthcare provider first, because some can actually cause you to have a lot of stomach upset. So as far as the baby's heart rate going down, that's not really the thing we're worried about. But generally speaking, in the first trimester, we're being very careful with vitamins in general, just because we want to make sure we're not affecting other electrolytes. So it can be used, but you want to definitely make sure that you're talking to your healthcare provider. I had a question on menstruation. So I haven't had my menstrual cycle for 3 months. What's the best age to try to start having a baby? So this was an interesting question. So a lot of people are trying to figure out what age is best. There's a lot of things that go into deciding to get pregnant and planning for your family. For starters, are you in the right place in your life? Now, when it comes to physical, and our right place in your life varies for everybody, just so you guys know, it's just, you got to know yourself and your situation. As far as physically goes, obviously the best time to get pregnant is when you are healthy, you're eating right, you're exercising, you have access to clean water, access to clean food, all that good stuff, right? But if you're talking about age, 35 and under, and believe it or not, as much as this sounds crazy, our young women, 18, 20, they're actually almost that ideal age. Human beings were having babies when we were 13 and 14 years old. I do not recommend that, of course. But so our bodies are at its best state when it's younger. Think about like the pain that Movie Mode mentioned with feet. And you think about the person I mentioned who had the hip pain. As we get older, there's lots of different things, wear and tear that happens to our bodies. So the younger we are, the better our body is in a position to go ahead and have a healthy pregnancy. Once you hit 35, you are considered a geriatric pregnancy. So you're considered an old lady. You have to go to a specialist. They monitor you. It's considered high risk. So if that gives you any idea, that is one thing that you should take into account. The other thing you guys should know, eggs. Women are born with the same number of eggs from the second we are born, like babies. Inside our bellies, we develop the eggs that we're going to have, or the follicles, and that's it. So every month you are ovulating, you are losing an egg or eggs. And so over time, your supply is running out and those eggs are getting older. There's a lot of research that shows that male sperm, as a man gets older, has more and more risks for having a baby with autism, for example. Female eggs are less fertile as they get older. So, obviously that's something to take into account. But can I say for sure what age? No, there's so many different factors that go into that. Let's see. Is azithromycin safe during pregnancy? Azithromycin is an antibiotic. Antibiotics are one of my number one questions on the channel, because everybody is so concerned about putting stuff into their bodies when you're pregnant. And actually, I got a question on hold on my vaginal discharge, my yeast infections. So I had two questions on there, which kind of go hand in hand with the azithromycin. So one of them said, I'm 31 weeks pregnant and I have asymptomatic yeast overgrowth inside my vaginal opening. Should I treat it or leave it alone? The other one said, I'm 32 weeks pregnant and experiencing slight itching around the clitoris with normal discharge, but nowhere else. So I'm taking, she lists a medication, Clinigen Forte, for a yeast infection, which is not something I'm familiar with. And she said, why might this be happening? So these all highlight one of the biggest risks for miscarriage. And the biggest risk for miscarriage by far is infection. When you're pregnant, you're immunocompromised, as I said. And so you're at higher risk for all the infections, including yeast, fungus, protozoan, bacterial, virus. And those can be in the vagina, they can be in the anus, they can be in your body, they can be a urinary tract infection. And all of these put you at risk for preterm birth, stillbirth, and miscarriage. And so we want to make sure they get treated as soon as possible. We need to identify the culprit. Is it a virus? Is it a bacteria? Azithromycin is an antibiotic. It kills bacteria. It does not work on a fungus like a yeast infection. So we need to know what we're dealing with. But ultimately, once we know what we're dealing with, we need to treat it. This is the number one thing that is just so heartbreaking to see, that people are so scared to take these medications and they're trying to focus on homeopathic remedies that don't exist. Unfortunately, it's just the nature of pregnancy. Pregnancy is too short to be messing around. I'm not big on antibiotics, guys. I really hate taking them. I don't use them anymore. I learned a lot about them over the years. When I was a younger person, I did not understand about them. But now we don't use like antibacterial soap in our house. We don't use the hand sanitizer. We don't use the like bleach sprays. Like, I don't use that stuff because that is all creating antibacterial resistance. And it puts us, me and my family, at a higher risk for that as well when it soaks into our skin. So what I want you guys to know is that I do understand why you don't want to take these meds. But when you're pregnant, you don't have a chance to like try to do anything else. You are at risk for this infection to escalate. So azithromycin is safe for use during pregnancy. It's widely used. It treats some sexually transmitted diseases. There is some studies with rats that show that 4 times the human dose, they are still not showing any signs of birth defects. So it's one of those things that you can really use. Now, what I will say about the yeast stuff is yeast infections are another very common cause of preterm birth, miscarriage. So you need to make sure those are getting treated as well. That what these infections do is they create a hostile environment in the vagina and the uterus. And over time, they can infect like into the blood vessels, which can eventually transfer over to the baby. And so that's why it's so important that we treat them. So as far as somebody who's having external symptoms of a yeast infection, you absolutely need to talk to your healthcare provider about getting that treated. For those of you who've joined me, hi, welcome, welcome. I'm Dr. Samantha. Please feel free to put any of your questions into the chat and I will try to get to them as soon as possible. I'm going to keep going on questions that I got on the channel. So I stopped breastfeeding my 15-month-old baby a week ago. Now my left breast is very large and painful with swelling. The milk isn't drying up. I'm worried. What can you suggest? So this is a very big deal. When women are ready to stop breastfeeding, it's important that we figure out how to dry up their milk very fast. If you have one side that is just becoming very engorged and stuff, you need to pump that one side. You need to make sure you're getting the milk out or you're at risk for mastitis. Now, if you have to, you just pump as much as you need to. So, but just enough to relieve the pain. The more you stimulate, the more likely your body is to continue to make milk. Use cabbage leaves. Cabbage leaves really work. And I know there's all this like cabo cream and other stuff that's supposed to be like the chemical ingredient of cabbage. I don't know, guys. It's full. We're so worried about like antibiotics. And I see this all the time. Everybody's so worried about like antibiotics, but they're quick to grab all these fancy creams and like nipple butters and all this other stuff, which I actually think is really bad for you. So I would stick with cabbage. That's what they've used for hundreds of thousands of years, probably. Cabbage leaves, you wash them, put them in the fridge, stick them on, wait until they wilt, and it absorbs into the breast. Another thing that you can use is peppermint. Peppermint is very well known to help dry up milk. You can do peppermint tea. You can actually do peppermints like peppermint candy. If it's real peppermint, it can actually help. And then believe it or not, I've had some women who use like peppermint oil deodorant. And because you have milk ducts up here, this will actually help to dry up milk. You also can put on cold compresses, and there's something else and I just lost it, guys. Whatever you do. Oh, sorry. There we go. Benadryl or Sudafed. You need to talk to your healthcare provider first to make sure that you are healthy to do this. Sudafed, for example, it can raise your blood pressure and your pulse, your heart rate. So you don't want to use Sudafed if you have some cardiovascular issues. Also, Sudafed needs to be used properly because if you take it at night, you will not sleep. It can cause insomnia. But and Benadryl can cause sleepiness. So you have to be careful with that. These are both used commonly for colds and for allergies. And what they're designed to do is dry you up. They dry up the secretions up here, right? Well, the thing is, the medicine doesn't know to dry just here. So it dries everywhere. And that includes breast milk. So when women are still wanting to make breast milk, right, they need to be sure that they don't take these because it can actually interfere. And another thing that can actually interfere with breast milk production / help you to dry up is actually allergy eye drops. Believe it or not, allergy eye drops can affect your milk supply. Whatever you guys do, if you know anybody or you've been offered, do not take cabergoline, which is also called bromocriptine. I'm so anti-cabergoline. So cabergoline is this amazing med. You get it for 10 days and it dries up your milk like that. So everybody wants to use it without knowing what it does. And so many OBGYNs and midwives prescribe it not understanding. So when you take cabergoline, it boosts some of the neurotransmitters that make you really happy, like dopamine. And so when women go on this, they feel like amazing. So not only are they drying up their milk because it works, they are also feeling really happy. And then after 10 days, you have to stop taking it. When you stop taking it, there's a drastic drop in your mood, and it puts you at high risk for postpartum depression. So this is why, if you don't understand how it works, and a lot of these OBGYNs aren't looking at the back end of things, you are actually potentially setting up somebody for a bigger issue. So I have, let's see, I have a couple questions on bleeding. I'm going to actually do this one first because I think this one is an awesome question. It came in on my bleeding video, but I think it kind of really is not about bleeding, and it ties in even with a little bit of the bed rest conversation we were talking about earlier. So I'm 22 weeks pregnant. Yesterday, I traveled 100 kilometers with my gynecologist's permission, but then I had some spotting without pain. Should I be worried? Could traveling be the reason? So the answer is yes. I don't know how much 100 kilometers is. I'm in the US, so we're on that stupid system of miles, but 100 miles would be too much. Traveling is a big deal, guys. Okay. So during pregnancy, one of the things that happens is you're at higher risk for blood clots. That's why we are worried about women staying in bed for bed rest if they don't need to be. Okay. So bed rest is a very big deal because it puts you at risk for pneumonia and blood clots because you're not moving your body around. Well, when you're in a plane or in an automobile or anything like that, and you're sitting for a long period of time, you are at risk for developing blood clots. So most of the time they're going to tell you to stop every hour to 2 hours, get up, walk around, stuff like that. But think about that. Think about all stress and strain that you're putting on your body when you're traveling. When you're traveling, we don't eat the right food. We don't drink enough drink. Everything is just off. And that puts a lot of strain on us. Now, additionally, 22 weeks pregnant. Oh my gosh, guys. I have taken care of so many women in my career who were on their baby moon or on a business trip, and they were in a completely different state. I'm in South Florida, so it's a very popular destination. So they were here, and they were here for months without their families because they went into preterm labor. And so they would end up in the hospital. We'd be trying to keep them pregnant. Oftentimes we kept them pregnant. Sometimes they deliver prematurely, and then their babies were in the NICU. So, and that's because traveling has a lot of consequences to your body. So if you can avoid travel, I really try to tell people to avoid it. I hate baby moons. Do a staycation. Stay near your hospital, your OBGYN, your midwife, because once you're in another place, it becomes so much harder. I had one woman who I took care of who was from Germany. She was in the United States for 8 months away from her family because she went into preterm birth, and we were lucky enough to keep her pregnant. But then she still had the baby almost 2 months early. I took care of another woman in South Florida who's from Alabama. And it was so sad because when she did finally leave, she was here for about 5 months. She had these big, giant chests of breast milk that she ended up donating because she couldn't take it back with her because of the travel time. So these are things that people don't think about. It's all these little things, and I see it. And most of these people are like, oh my God, I would have never traveled had I known this. So I would try to avoid travel if you can. And probably with this spotting, it'll probably go away after a little bit of time. All right, movie mode. I saw persons use progesterone creams to aid with certain issues like cysts in the breast and aid with preterm labors. Can this help with the lengthening of a cervix? It cannot. Once your cervix is shorter, it is shorter. It doesn't, unfortunately, it doesn't grow or thicken. Short is literally length, right? And what is happening is this. And the progesterone does not change that. When it's talking about preterm birth, it sometimes will create a better, thicker environment, like thicker uterine like lining, better flow. But actually, they're starting to learn that progesterone may not have the same like benefits that we thought that it did. One of the shots, McKenna, has been taken off the market again. It was given an FDA fast track clearance 10 years ago or something like that, because the preliminary data showed that it could prevent preterm labor. And after 10 years of it being used regularly, doesn't hurt anybody. They've not found it to be detrimental, but it really actually doesn't do anything. It doesn't really help. So, it's one of those things that it's hard to say whether it's going to be useful or not. But if your doctor's using it, please use it. That they have a reason, have them tell you the reason. There's no negative evidence against progesterone, but lengthening, no. And unfortunately, some people are born with a short cervix. So most women, I mean, guys, if you ever want to feel your own cervix, like wash your hands, put your fingers inside your vagina, this is what you're going to feel. Okay. And length is like this, right? But it can be shorter, right? It can be shorter. So, and you can be born that way. And then that's like, a thing. Okay. So let's see. I'm 13 weeks pregnant after having a miscarriage at 10 weeks. Yesterday, I started having light bleeding. My doctor checked and said the baby was okay, but now I'm having heavy bleeding. I received a I'm going to pronounce this wrong because I don't have this medication in the US, Gravibinon injection, and the doctor advised using Projfic vaginally. What should I do now? The other one said, I'm 22 weeks pregnant and still bleeding. I'm worried. What can I do? So, one of the things that happens with some of these bleeding things is that when you're bleeding, you have to be very careful because we don't know exactly what's going on. In the first trimester, there's a lot of reasons why you could bleed. You could bleed because of like a placental bleed that's going to resolve like a subchorionic hemorrhage. You could bleed because of sex. You could bleed because of an infection. But once we get into second trimester, we start to get a little bit more worried. And we get worried because the second trimester is a big time that we're in this tenuous place where if you get far enough along, we can actually get you to a point that we could deliver the baby if we need to. So we really try to be mindful of what's going on. The other thing is by the second trimester, you're usually not having bleeding from sex and other things. So the biggest thing you can do, number one, call your doctor. You guys need to call your doctor if you're bleeding because they can do tests to figure out what's going on, like an ultrasound, like blood tests to see if you might have an infection. They can do an exam. They can look to see what's going on so that they can try to, help you out with that. And then from there, you want to make sure you're eating right. Make sure you guys are hydrated. One of the number one causes of preterm birth that we see is dehydration. Dehydration will cause your uterus to contract. So you want to make sure that you're actually staying hydrated. So those are some of the things that you want to look for. Okay. So that's always a big one. Let me see. Can I transfer trichomonas to someone else without having intercourse? So trichomoniasis is a sexually transmitted disease. We treat it with antibiotics, and it is transferable. So what a lot of people don't realize, and I don't want to make people paranoid, but trichomoniasis can come from contact with damp or moist materials or objects, such as towels, wet clothing, a toilet seat, and of course, genital areas. So what you need to make sure of is that you're being very mindful of that. Now, if the person's question is, could I have gotten it from somebody without having sex? Yes, you could have. If your partner had it, you could have. The most important thing is if you have any symptoms, you want to go get checked out so we can swab you and we can potentially treat you, or we would treat you if we find out that. Now, before everybody starts being paranoid, there's a whole bunch of sexually transmitted diseases that you cannot get from toilet seats. Like one of the biggest ones people get worried about is HIV/AIDS. HIV is not transferable from blood on a toilet seat. Doesn't happen. HIV, believe it or not, outside of the human body is actually very fragile and dies very quickly. It's inside the human body, inside our cells, that it actually thrives and does much better. So not every single disease can be caught that way. So please, please, please don't get paranoid. I had an interesting question. I don't know where it came. I mean, I know where it came from, but I don't know why it came. So I'm going to answer it. Why can't pregnant women eat pineapple? Pregnant women can eat pineapple. Not sure where that came from. So I guess a couple things. If you have diabetes, you probably shouldn't be eating pineapple. Pineapple is very, very high in sugar, although it's a natural sugar. So there's that. But the one thing I can think of is that pineapple contains an enzyme called bromelain. And bromelain helps to break stuff down in your body. All enzymes do. And I know that there's some issues with bromelain because what happens is it can actually break down some of your body's proteins, which causes you to have potentially abnormal bleeding problems. And of course, in pregnancy, you're highly vascular. We don't want to see bleeding at all. So that's what we're worried about. And so you might see that as the reason, and you might see it as a high risk for miscarriage. But actually, guys, it's really not the case because bromelain is found in the core, that center part of a pineapple. And anybody who's eaten pineapple, well, first of all, if you see the slices, the core is always out of it. It's not there. That center core really isn't edible. And that's where most of the bromelain is actually concentrated. So as long as you're not eating that center core, you should be fine. So pineapple is okay. For any of you who are joining me, hi, please feel free to put your questions into the chat. And those of you who stick around to the end, I will tell you about my video tomorrow. Let's see. I am 35 weeks pregnant and my feet and hands are swelling day and night. What can I do to alleviate this? What can you do if you're 35 weeks pregnant and you're swelling all the time? Please go to the hospital and please go every single day until they admit you for preeclampsia, because that is exactly what is going to happen. So let's just be very clear on swelling. It is common for women who are pregnant to have swelling in their legs and their feet. That is common. It's because of all the circulation and all the vascular flow. What can you do? Compression socks, walking, keep your feet elevated, that kind of thing. But once you have swelling any other place besides that, I start to get worried. I can tell you, oh my gosh, a month ago, I had a mom and I saw her on camera. We were doing a telehealth because she was almost ready to deliver. And I was like, man, you look really swollen. You look really swollen. And she's like, yeah, I thought I was a little swollen. I'm like, did you check your blood pressure? Guys, please check out my preeclampsia video. It talks about how swelling and high blood pressure are signs of preeclampsia. And she said, they told me my blood pressure is fine. Not 2 days later, she had preeclampsia. Not 2 days. She ended up with a C-section. Baby's fine. She's fine. Thank God. But if you see swelling up here, that is not what we consider to be normal pregnancy stuff. And of course, it could be. Maybe nothing happens. Maybe it's just you're swollen. But I mean, I'm telling you, 9.5 times out of 10, it's going to end up being some form of preeclampsia. So what do? You need to know the signs of preeclampsia. You need to know vision changes. So it could be spots, blurry vision, halos, darkening, anything like that. Headache, a headache that doesn't go away with Tylenol, that feels different than any other headache you've ever had, or right upper abdominal pain. Those are the 3 classic signs of preeclampsia. So those are the ones you want to look out for. The final thing I'm going to say about swelling is this. If you are dehydrated, your body will hold on to fluid. And that doesn't seem to make sense to a lot of people. They don't quite get it, but it's true. Your body, if you're calorie deprived, right? Your body holds on to calories. That's why you have to be careful when you're dieting or doing something like intermittent fasting, because if you don't eat enough calories, your body's just going to hold on to everything. Same thing with fluid. If your body is dehydrated, it's going to hold on to every bit of water it has to try to make sure that you're okay. And pregnant women have a tendency to not drink enough fluids because they don't want to pee that much. So if you do that, you're going to end up with an issue. Okay, I'm going to try to say it. Akuta Kanda. I hope I said that right. Welcome. Why do I have wounds around the vagina and I am 1 month pregnant? So that is a very good question. So what I'm going to tell you is this. You should not have that. What it could be is it could be that the hormones for pregnancy have possibly activated a dormant virus. So the most common virus that I would imagine could be herpes simplex virus. A lot of people don't realize this, but most of us are carrying the herpes virus. And the herpes virus, the one that causes some of your mouth sores, can also cause genital sores. And so that is oftentimes what it is. Remember, you are immunocompromised. And so when you're immunocompromised, a lot of things can actually surface. So what you want to do is you want to go see your healthcare provider so that they can take a look at what's going on and they can prescribe medication. There are antivirals that can be used for this to help to treat it. The other thing is it could be that you've actually got some tears. So remember, guys, during pregnancy, the hormones that help you to have a healthy pregnancy, they thin and dry out the vaginal tissue. So there's a lot of things that can happen that can cause that tissue to tear, and you can actually get like little infections and stuff from that. So that could be why you have that, and you want to go get it checked out for sure. So I hope that answered your question. Okay, got a question on my thiamine deficiency video. There is thiamine deficiency thiamine's a B vitamin, and it's very important. It's very detrimental to the health of your pregnancy if you were to have it. What happens to carbohydrates that cannot be digested without thiamine? What's the best test to check thiamine levels? So if you don't have enough thiamine, you're so welcome. If you don't have enough thiamine, you cannot actually process your carbs. A lot of people don't realize that. So you can't utilize the sugars that are in some of your food that you need. And actually, just so you know, it's not just thiamine, it's any of the B vitamins. B vitamins are very essential for doing a lot of things in your body. All of them can process carbohydrates. But of course, we get worried about specifically thiamine. Now, one of the things is it's very uncommon. So this is not going to happen very often. The two people that are most likely to have thiamine deficiency, one, alcoholics, okay? And two, people whose diet is primarily white rice. So let me say it again. People whose diet has a lot of white rice are at risk for thiamine deficiency. So these two different things don't allow us to absorb a lot of thiamine, which is why we end up seeing it. And one of the things that happens is you can develop a disease that can actually cause some brain damage, both in you and the baby. So what do? You take a B vitamin. The nice thing about thiamine, there are tons of stuff, tons of foods that have thiamine. Please, you can go online and look up. I always tell people when you guys need food or you need to use food for a vitamin, in today's day and age, Professor Google is really bad for a lot of things, but Professor Google is really good for looking up food. So if you know you need iron, go to Google, what foods contain iron? So for thiamine, you can go to Google, what foods contain thiamine, right? And then what happens is you can get a list. And what I tell my patients is you get this list. So thiamine, it comes in nuts, peas, sunflower seeds, pork, black beans, right? So you have this whole wonderful list. And then what you guys can do is you guys can look at that list and focus on the foods that you like to eat. Now, this is a big problem people do. They hear they're allergic to, you're iron deficient, right? So you're iron deficient and you go onto a list and the number one thing that has iron is liver, right? I can't eat liver. You would never catch me eating liver. That is never going to happen in my lifetime, right? It's like, ugh, some people love it, not me. So there's no point to me trying to stuff down liver when I don't like it and I'm not going to be able to do it. Instead, if I need iron, I can focus on, I do eat meat. I can focus on steak and I can focus on spinach. Spinach is a great form of iron. So it's one of these things where you want to look at what's there that you eat and use it to your benefit. And the only other thing I'm going to tell you guys, of course, with your thiamine deficiency, with any of the vitamin deficiencies, you can take a B vitamin. Iron deficiency, you can take an iron pill. But human beings were designed to get our nutrients from our bellies, from our guts. So ultimately, your food is the best medicine that you can give yourself because you're going to absorb the highest amount of that food and those nutrients. So whenever you can, try to get it through your diet. Anybody who has any questions, please feel free to put them into the chat. I have 2 more that came from the videos. Okay, so the first one is, I have been experiencing unusual symptoms, intense hunger, craving foods I don't normally eat, white and pale yellow odorless discharge, no burning sensation, strange sensations in my lower abdomen, nausea with gagging, and unusual breast sensations. This isn't my normal PMS. Could I be pregnant or is it something else? I'm getting worried. So, could it be something else? It could absolutely be something else. Could you be pregnant? Absolutely. So for starters, guys, if you think you're pregnant, you need to take a pregnancy test as soon as possible, like right away. Because if you are pregnant, there are changes you need to make, like not drinking alcohol, not smoking, like all these things, right? You need to know what's going on in your body to understand how you're going to proceed. Just so you all know, dollar store pregnancy tests are extremely accurate. They're like really accurate. A lot of people want to go out and spend all this money on pregnancy tests. The dollar store, theirs is just as good because all we're testing for a pregnancy test is the hormone HCG, human chorionic gonadotropin. And so all we're looking for is if it's in the urine. That's why it's just a positive or negative. That's all it is. If it's there, it shouldn't be there unless you're pregnant. So that's where you get your positive. So you really don't need a lot of rocket science. It's not very hard. Yes, those 2 little lines and all that, is it there? Is it not there? That can be confusing. It's really obviously really cool to get the ones that say electronically pregnant. That's pretty easy to read, but you don't need them. They really aren't. So if you guys think you might be pregnant, please take a test. That's the most important thing. Now, from the second of that, right? Intense hunger and craving foods that I don't eat normally. That could be diabetes. Okay. So a lot of people don't know it. Intense hunger, intense, my gosh, guys, I guess I'm tired. Intense thirst, going to the bathroom all the time. These are signs of diabetes. So that could be something like that. Discharge absolutely could be an STD. Breast tenderness, pregnancy, PMS, so all these things could be something else. So would I say that it's something to be concerned about? Honestly, not necessarily. Whenever you guys are concerned, definitely go to your healthcare provider, but take a pregnancy test to begin with. If you think you're pregnant, take a pregnancy test so you can decide what's the next step. Okay. I have one more question, guys. So if you guys have any questions, put it into the chat and then I'll also tell you about tomorrow's video. Okay. So, this was on my water for formula video and it said some sources suggest formula can be contaminated with bacteria. So boiling water should be added and then cooled down. Is this true? So as many of you know, if you've been on my channel for a while, I am a board certified lactation consultant for, I think, 15 years now. So obviously I have a lot of expertise with breastfeeding and I am a very big advocate of formula. I think formula is absolutely hands down one of the best things that we have available to us because not everybody can breastfeed. Not everybody wants to breastfeed. And frankly, there's I think at least 2 or 3 times a month where I'm looking at a mom and I think breastfeeding is interfering with your mental health. Maybe we should stop. And I know that's a very controversial thing to say, but we should be embracing people's feeding choices and not putting them down. So when it comes to formula, though, there are reasons why we say, like, hey, maybe you shouldn't formula feed, right? And these aren't, when I put these out, I don't want anybody to feel shamed. You need to know how to take care of your baby. That's it. It's just about learning that stuff. So like I have a video on like European formulas versus American formulas. And like right now, a lot of people are very, very interested in European formulas and they're really very cool. The problem is they're not very reliable on their source. So European formulas, if they're coming from legitimate sources, you have to order them, right? And they're coming across the ocean. It doesn't matter who you are ordering these from. Any shipment coming to the United States from outside the United States can be stopped in a port and held, and you may never get it. And then you're having to wait for them to send another shipment out. A lot of people don't realize that. So there can be delays and all this other stuff. Additionally, if your European formula sent over this big, giant, thousands and thousands of cans of like formula, right? And it gets held in our port and like denied entry. Well, now all that stuff needs to be replaced. It's not just your can, it's everybody's. So that's one of the risks with it. Now, the other thing with European formula, but also, frankly, even here in the US, is that these things are also being run on trucks. They're not always in temperature controlled environments. And these are all a risk for bacteria. And then manufacturing stuff, guys. Like, and that, like, we want our babies to be safe. And so I understand when there is issues with baby formula, why everybody gets really, really, really upset about it. And they should, of course. We want to protect our babies. But understand how many other recalls are there also. This happens with a lot of different things. So this should not be a reason that we're shaming people for using formula. Now we need to teach people how to make sure their babies are safe, right? So one of the things you can do is you can actually boil water. So that boiling water thing is actually a real thing. It's a real thing. You want to boil the water to 70 degrees Celsius or 158 degrees Fahrenheit. You absolutely want to let it cool down. You cannot serve that to a baby, obviously hot. It's going to hurt the baby. But that is a very, very, very legitimate way to help to destroy bacteria. Hi, Kyle. I think this is a while since you've been back, so welcome. How would a midwife check me to see if I was in active labor? So from a physical standpoint, really nothing. It's contractions. Active labor is basically a regular contraction pattern. So a lot of times they'll tell you to go to the hospital when your contractions are 3 to 5 minutes apart and they're lasting for at least a minute. Everybody's provider is a little bit different. Part of the reason why it's different is where you're located. So, for example, there are big parts of the United States where women are an hour or 2 hours away from their healthcare provider. So they may be told to start heading in when their contractions are 7 minutes apart. And then there's other places like me who's here in South Florida, and there's probably like 5 hospitals within like 10 minutes of me. I could probably wait until I'm like 1 minute apart, right? So really active labor is that. So when your midwife is checking you, one of the biggest things your midwife is checking is to see cervical favorability. So what that is basically what's the length of your cervix, right? Is it long? Is it thick? Is it closed? What's your dilation? And how soft is it? So a soft cervix is going to dilate faster. Okay. It's going to do this faster. When we do inductions, the doctors are supposed to do this like little form that tells all these different pieces of how your cervix is in order to decide whether you'd probably have a successful induction or not. Do they do that? No, I not really, but they should. And one of the questions is how soft is the cervix? So I always use my fingers, guys, because first of all, YouTube's not going to censor me for my fingers. But second of all, I cannot tell you again how close this is to a cervix. And it feels about like what your fingertip feels like. That is a kind of closed, solid, not in labor type of cervix feeling. This truly is what fingertip feels like. This, I mean, like spot on. So what a soft cervix feels like is like mushy and squishy. Like I don't know, like imagine like soft watermelon or something. It's very, very squishy. And that is a sign that you are probably getting ready to be in active labor. One of the other things that we are looking for is dilation. If you have a spotting, that can happen. But really active labor is about your contraction pattern. It really is not about like dilation or anything like that. Now, what your midwife could do, and I have a video on this, is if you are dilated enough, your midwife could go in and sweep your membranes. Okay. And what that is that the amniotic sac over time, it develops some membranes that attach to the uterine wall. They can go in and with their finger, they can sweep, and that releases the membranes, and it releases a prostaglandin chemical, which can trigger labor for you. Any of you guys who get your membranes swept, just so you know, it is very painful. They try to tell you that it's not painful. It's just a little uncomfortable. Guys, it's painful. You'll live. If you want to have it done, you'll live. It's fine. I think it's unfortunate that they try to dismiss what it feels like. You know, stripping your membranes is pretty uncomfortable. So if you think that they're going to be doing that for you, and you know that kind of ahead of time, ask for your partner, your friend, your mom, somebody to come with you that, you know, can hold your hand, because it is uncomfortable. So with that, we got through a week with no technical difficulties, no nothing. For those of you who stuck it out, I have 4 videos in the can ready to go over the next couple weeks. And tomorrow's video, remember, like and subscribe and hit the notification bell. Tomorrow's video, for those of you who stuck around, is a video on water breaking. How to know if your water has broken, what to expect, what to do. Kyle, that can be one of the signs of active labor. So I hope you check it out, because it's one of the biggest questions that we get. This is also a really good video for partners, for support people, because they're probably more worried about it sometimes than the pregnant person is. My name is Dr. Samantha. I am the maternity mentor. I am here every Monday at 9 p.m. Eastern Standard Time to answer your questions live, to also answer any questions that you've put onto the channel. Please give me your suggestions. At least one of the videos coming up was a direct suggestion from one of my viewers, like direct. I think it was in one of my lives, actually. So one of them coming up is from that. I do take those seriously, and I do try to put out that content. I really appreciate all of you. Thank you so much for supporting the channel. Share it, like it, subscribe. My name is Dr. Samantha. Bye for now.